folks have joined. Hi, Wood and Emmy. Thank you for joining us today. And I also see Carl on the line. Hi, Carl. We are glad to have such a good group and look forward to the conversation. Just as a reminder, if you do want to see on a big screen the folks who are talking, and I say that because that will soon be Melissa and Dr. Francois to get us started, you can go to the top right of your screen and click between speaker view and gallery view and decide which of those you like best. So that'll be my final reminder for that, just because I know many of us are probably very well versed in Zoom at this point. If you don't know me, I am Clark Siped. I'm the Executive Director of CCH here in the States. I see Dr. Francois down at the bottom of my screen. He's in the blue shirt with the very well-prepared mask. And Rubens, who's the in-country director for CCH, is next to him in that screen. He's in the golden shirt with the mask. Dr. Francois is the lead physician for CCH's healthcare ministry in Haiti. He's been working with us full-time now for several years, but has actually been working with CCH in Jacmel since the earthquake in 2010 in a variety of different capacities. And so we are thrilled to have his medical expertise leading and innovating within our mission, and thrilled to have him on the call today. So you'll hear from him shortly. Melissa Jean-Bart is also on the call. You'll see her as admin on your screen. She's in the golden shirt. She's in the middle of my screen. I don't know where she is on yours. Melissa is the health resources and clinic coordinator for CCH in Haiti. If you have ever traveled with us and served alongside our staff in Haiti, you have met all of these people, most likely. And Melissa really navigates a lot of different spaces, connecting our clinical services with community pathways for health education. She does a lot in strategically stewarding those partnerships across Haiti. And so we're excited to have her expertise and perspective with us again today as well. Just also want to let you know, Abby Gwaltney, our Director of Communications, is on the call. Abby, wave your hand. She is muted because there are many, many children in her house, but she will join us as needed. I already introduced you to Kate. Carson Rich is our Director of Development here in the States. He's here. Carson doesn't have kids at home. His kids are grown, but his cats can be really loud. So he's also muted currently. And then I also see Murray Buckwalter on the call, who's our stewardship coordinator and our former development director. So you'll recognize her as well. Several board members, Wanda, Wood, Carl, Mike. Very, very happy to have everybody on the call. Many of you have been to Haiti with us, so thank you for joining us today. As we get started, and again, I'm just going to seed a couple of conversations because we do want you to put your questions in the chat box below. But Melissa and Dr. Francois are going to get us started, and really, I just want it to be your opportunity to have a conversation with them for a large part of our time together today. So Dr. Francois and Melissa, let me ask you this. All of us have been living this global pandemic for months at this stage. Many of the folks on the line, if not all of them, have been following our written updates. Can you take just a minute and give us a quick summary of COVID in Haiti in the numbers? You know, Haiti recorded her first case, her first COVID-19 positive case towards the end of March. Tell us what has happened since then. How can you summarize that for us in numbers?
Okay, I'll take on that question. Again, hi everybody. It's good to see many faces. So as far as in terms of numbers, in terms of statistic, that's a very big element when we talk about epidemic and understanding how this virus is moving, you know, in the world, but particularly in Haiti. So Haiti first registered their first cases of COVID-19 on March 19, and those two cases were cases that were foreign cases. So they were Haitian citizens that, you know, visited abroad, and then they came back and had COVID symptoms. So the first two cases were registered on March 19 with an announcement that the president of Haiti made. At the time, he implemented stay-at-home measures, and a lot of international flights, airports, and borders, all of that was cases. And that's still in effect at this point. As of June, I'm sharing with you the latest numbers. Out of June 15, we have about 4,441 confirmed COVID-19 cases. As you could see, from less than 2 months, literally, we went from 2 cases to, I would say at this point, close to 4,500 cases. Again, those are confirmed cases. We have about 9,407 suspected cases. So those are people that have been exposed to patients that are confirmed cases, and they're still being observing them for symptoms until they can determine whether or not they will get tested. In terms of deaths, we have about 76 deaths. And again, those numbers, bear in mind, those are numbers that are reflecting based on tests that are being done, okay? And we'll talk a little bit about that, why those numbers, we can't really trust the numbers because they don't truly reflect the rate of the epidemic in Haiti.
Trying to read.
So in term of, for example, what we call right now, based on how the numbers have been growing so fast in Haiti in less than 2 months, we are at what we call right now our exponential growth. And if we look at, for example, just 3 weeks ago, we were at about 2,000 cases, I would say. So there's been a 24 more times infection rates since mid-May, okay? This is very, very alarming. Very alarming, you know, when we talk about the disease itself. I want to talk a little bit about originally, in terms of numbers, what the Ministry of Health had said at the beginning. So at the beginning, when COVID first made its appearance in Haiti, they thought about that their projection was that 86% of the population of 12 millions would eventually be exposed to COVID. Again, that's their projection in terms of numbers. I can't really say how did they make those projections, probably just looking at the way COVID exploded in other countries like in Europe or Asia, but this is the projection that they've made at the beginning of that. They expected what they have projected in terms of deaths. It's about 20,000. Again, this is the worst case scenario. The worst case scenario was 20,000 deaths, and the best case scenario is 2,000 deaths. Okay, so where are we now? Where we are right now is once Haiti, in terms of testing, again, anybody that follows the virus understand, in order to understand the epidemic, you need information, and information is data, and data is testing. This is how you could track your epidemic. This is how you could see how many people are being exposed. This is how you could see where your cluster areas, which area are more susceptible to become, mega, I would say, a hotspot, like they like to say in other countries. And Haiti, in terms of testing for the entire Caribbean, has the lowest rate of testing, okay? Originally, the Ministry of Health had said you had about 19,500 tests available. That's what they had. And my understanding right now, they've done a little bit over 9,000 tests. One of the bigger concerns we had with testing is lack of supplies available. For a while, they had issues with getting reagents available. And again, it's a shortage that's the whole world was experiencing. So right now, what the numbers they had set for testing is 19,500 tests available for 12 million people. So their protocol right now is we're only testing folks that have symptoms. Now, the biggest issue that we have in Haiti right now is when we talk about people wanting to get tests, people that have to get this is one, there's a breakdown in the infrastructure as well. It's not easy to get tested. If you, as a clinic, for example, at CCH, if you want to refer somebody to get tested, it's very difficult because the testing sites are centralized in Port-au-Prince. So for example, in other towns in Haiti, a clinic, you can only go to the Ministry of Health where they have testing centers available. The specimens are taken in those centers and sent to Port-au-Prince. So in the entire nation, for 12 million people, there's only 2 testing centers that could actually run COVID tests. So that's a big, big challenge in terms of just making the test available, okay?
Melissa, can I ask a question about that real quick?
Yeah.
One of the things, folks on the line, I don't know, many of you read about Haiti, you get updates about Haiti daily. How many people saw contradicting headlines just today? So there was one article that came out that talked about how Haiti has reached its peak and cases are starting to go down again. There was another article in the very same news feed that talked about how a new case is identified every 7 minutes. And a third article that said Haiti's cases are increasing in number exponentially every single day. And I think this is a testament to exactly what Melissa's talking about. The data we have in really understanding the trajectory of this virus is not solid. And the 4,000 and some odd confirmed cases are just that. Those are people that have actually been able to be tested. The sample that was taken made it to one of those 2 centers that Melissa references that can actually do the test itself to confirm a diagnosis, yes or no. And then that information made it to the Ministry of Health. So you have to think about just the limited capacity, the system and the infrastructure that's set up to track that. We're having trouble here in the States really projecting and following that data. And you can imagine, you know, in Haiti, the additional complexities around that. Melissa, I think so many points there, and I'm hopeful folks start putting your questions in the chat box, because we're gonna take those momentarily. Given that complexity, though, Melissa and Dr. Francois, what's it like day to day? I mean, you're talking about one projection saying 86% of 12 million people. That's a lot of people being exposed to this virus. CCH is one of our priorities in all of this has been to keep our clinic open to continue to serve the men, women, and children that need our care, not only for COVID-related symptoms, but just for the regular, routine, and emergent healthcare challenges that people face every single day. Safety has been a huge emphasis in that. We've had to prioritize keeping our staff safe so that we can continue to serve people. And with 86% of the population potentially exposed because of high density living, lack of sanitation, you know, kind of a slow rollout of some of this prevention messaging, what is happening day to day at the clinic to help us keep people safe so that we can continue to serve?
I will answer part of that question, Clark, and then Dr. Francois will more handle the treatment part of things. Sure. So the good thing about, I mean, I would say it's a blessing for us in that sense, because even before COVID, I would say even before March 19, we were on the forefront with our staff getting ourselves ready, because we knew that it wasn't a matter of if it's going to happen, it was a matter of when it's going to happen. So before that, we had to ramp up our training for staff in terms of safety, in terms of protocol. We'd make sure we had items available for protection. We made sure that we train our nurses on protocols on how to triage, how to detect people that may present themselves with COVID-19. So that was even done before March 19. So when you know when they announced the first 2 cases, we felt confident as far as, you know, if we were ready. So right now, this is what's happening right now in the clinic for a protocol. We instituted a protocol where every patient that comes to our clinic, they have to go to a triage station where some of our staff, nurses, and some of our PT staff as well are triaging them, taking their temperature, asking them questions about their symptoms. Okay, so this is the first barrier. Every patient that comes to the clinic as well is, every patient that comes to the clinic also is trained on how to protect themselves, because it's prevention. It's really key on how to really stop this disease. So every patient that comes to the clinic are taught about how to protect themselves, how to keep their loved one and their family safe. And then if we do have patients that have suspected, what we call suspected patients. And then this is where a second layer of I would say, protection comes into place, where we have one of a physician that kind of go and ask them question and see them. And Dr. Francois could kind of talk a little bit more about that, because this is an extra layer of training and an extra layer of patient care that the physician has to put into place in order to see those patients. Dr. Francois, you want to talk a little bit more about the station number 2 when we have patients that are suspected for COVID, if they come to the clinic, and how we see them? Because we've been getting lately a lot of them coming to our facility.
Yeah, the way the protocol was created is like to try to separate to do the triage from the beginning. I didn't hear the whole thing because I have to tell you guys I'm sorry. At some time I have to log out and log in back. Yeah, so we talk about the second station. Once they ask the patient some questions regarding the symptoms, if they have been in communication with other people that are symptomatic, and also if they've been travel or get in touch with someone that is traveling. So they were sent to the based on the triage, they were sent to the second station. That's mainly it's that point. The patient is one of the doctors should go down to the station number 2 with everything, including the PPE and all the stuff to protect the staff from getting contaminated by the COVID. So at that point, the doctor will do a second interview with the patient and ask more specific questions based on the previous question that the patient already asked, and add additional question more specifically. And if the doctor determines that the patient should get tested, so right away it'll be considered as a suspected case of COVID-19. So we make a phone call and make arrangement with MSPP through Dr. Judy, which is the head of the department in Southeast. So from there, they will decide if they will send a team. Sometimes it's difficult to have a team. It's very difficult to have a team come right away. It might take hours. And in order to avoid that, we can make arrangement also to transfer the patient out to the testing center. And from prior to do that, we will also give drugs, treatment to the patient. We will treat the symptoms, and eventually we will send that to the testing center. And there we will stay in touch with them. If the result should come positive, and they will let us know regarding the result. If it's outcome negative, usually when the result is positive, they give you will have it within 48 hours. If it's negative, it might take some weeks before you get the result.
Thank you for that, Dr. Francois. I mean, Dr. Francois talked about how sometimes it can take a team hours to get there. And I remember hearing from Dr. Francois on the very first day that we had suspected patients. We had these protocols in place for weeks before a suspected patient walked through our doors. That's how prepared Dr. Francois and Melissa and their team were. We had our first 2 suspected patients come separately on the very same day. There was a strict protocol in place with the Ministry of Health, MSPP, that said, call this number. And many of you on the phone, if not all of you, have been to Haiti before. We called that number, and guess what happened? They said, sorry, we can't send the team. We don't have a truck right now. Welcome to Haiti, right? This is why we've had to be creative and innovative. Dr. Francois is talking about, we have pulled out all the stops to get folks connected to this testing, but it's still few and far between. And that's why And Dr. Francois, correct me if I'm wrong on this, a very new development within the last week and a half, MSPP put out an alert to all clinics across the entire nation. Originally, we were given guidance, do not treat patients. If you have a suspected patient, you need to send them to the closest testing center. They will be managed through the system run by MSPP. The new guidance coming down from the ministry, and you know that that's part of CCH's MO, right? We do not work in isolation. One of our goals is connect all these moving pieces. Their latest guidance to all clinics is to treat those who have moderate symptoms. Everybody. So the burden of the greatest part of that treatment is now on clinics just like ours, many of which are very under-resourced, very under-equipped, which is causing more and more patients to come to us. Now, treatment for some of those more acute levels, folks that need respiratory therapy and the like, is still those options are very, very limited. Our closest options in Jacmel are St. Boniface, which is still quite some distance away, and then Port-au-Prince. There is not yet a treatment option for acute care in Jacmel, even though there is a national commission working on establishing those sorts of sites in every single department.
I have a question, Clark or Dr. Francois.
Sure.
What do you mean by calling the team when you have a suspected case? What exactly does that mean?
Sure. Melissa or Dr. Francois, can you describe that just briefly?
Yes,
Sure.
because
Go ahead.
since we don't have the capacity to test the COVID-19 patient, so MSPP put a protocol. So because from the beginning, they say they are the men will be responsible to manage the COVID-19 because it's a government thing. So we only have I think in Haiti, they only have two labs to do the testing. Even in Jacmel, we don't have a lab to do the testing. Yeah. They will take the sample and send it to Port-au-Prince. Okay, so because of that, and it's about equipment also, and we don't have that equipment available so we can perform the test. So we are dependent on MSPP because they have a team, and on Jacmel they only have one team. So if there's a suspected case, they will send a technician with everything, equipment and material to do the testing.
I see.
That's the reason why we're talking about sending the team or waiting for the team to come.
Right. And Carrie, to your question in the comments, that team is based at Hospital St. Michel.
Okay.
Kind of charged and tasked by the Ministry of Health.
So you don't. Go ahead. I'm sorry.
No, go ahead.
So there is no test. There are no test kits at the CCH clinic. You call this team.
No.
Collect the samples.
No.
Yeah.
Correct.
No, we don't. We don't.
The access is very limited.
Yeah.
Okay. And Clark, there's something I want to add based on what you said. And we knew when MSPP say basically they will take care of all COVID-19 patients. We knew that was a false. That wasn't true. Is that the reason ahead of time the plan about in case one of the staff members get infected by COVID-19? So that's the reason we decide if we're gonna have to do the follow-up to take care of that staff member at CCH Primary Care Clinic. So it's something that's the reason why we put all the protocol in order to protect our staff and also the patient that come to CCH Primary Care Clinic. So we know from the beginning this is not gonna be working.
Treatment across the board is one of the greatest challenges at this stage. And Dr. Francois has been integrally involved in trying to make that a very real, accessible option for patients in Jacmel, and it has been 2 steps forward, 1 step back. for the last several weeks. Dr. Francois, I saw another question, Kate, in the comments about testing, and there was a question about rural. Can you share that one with us? Something about rural versus urban?
Yes, so a couple of questions about testing, and I think we've touched on this, but just to very clearly answer them. Where is CCH sending folks to get tests? We talked a little bit about that team, but just to clarify that a little bit more, where do people get the tests? And then are most people being tested in urban areas? And what about the rural areas? How is testing getting out to those people?
What happened right now, people don't really get tested. The reason why they don't have enough tests, the only reason a patient gonna get tested if there's a suspected case, and it has to be done by a medical doctor. Mm-hmm. So without a medical doctor, the person cannot walk through and say, "I just want to be tested." In case, that's the reason why from the beginning I told you I was trying to get, if I can get all the CCH staff to be tested. We don't have enough tests in order to do that. So every time there's a patient that need to be tested, we have to send it to the St. Michel Hospital. That's where the testing center is.
Mm-hmm. As far as the urban area and the rural area, so for example, right now in Haiti, Port-au-Prince, the capital, is considered the epicenter of that epidemic, which about the 80% of those cases of COVID-19 are in Port-au-Prince right now. And the remaining number is, throughout Haiti, all the 9 different departments. So there's not one single department at this point that has not had a suspected case or a confirmed case of COVID-19. So for example, in the Southeast area, which is a question that I saw in the chat, we have about 87 confirmed cases. That's for the Southeast. And the Southeast, it's the entire department where Jacmel is or CCH is, but there's many towns as well in that department. And the majority of those 87 cases are considered in the town of Jacmel, okay? And I saw a question about the northern part of Haiti. It's about 121 cases. Again, those are confirmed tested cases. It doesn't count for people that may be infected, never been tested. The other thing also I want to point out is the deaths numbers. The death numbers, people could say it's extremely low, but what we're saying is it's only reported death cases that have died with COVID-19 with a confirmed diagnosis of COVID-19 in a hospital setting. It doesn't count, for example, people that are dying at home that have not been tested or not been confirmed, or people that are dying in, for example, rural community and slums, because we could see the majority of the testings are occurring actually in urban towns, urban areas.
Melissa and Dr. Francois, you shared with me earlier today also that COVID patients in Haiti are presenting a bit differently than they are in other places. We're not seeing a lot of, really prolonged fevers, headaches, those sorts of things. Folks are kind of showing up really, really quickly with pretty significant breathing problems that in many cases are leading to a very quick demise. Can you speak to that quickly, and what parts of the population you are seeing be most severely impacted by the virus? Here, for example, in the States, we talk about the older folks and, vulnerable populations there. But Dr. Francois, you told me about a young nurse, 24 years old, that died very, very suddenly, and it's been attributed to COVID.
I don't know if you guys can hear me because I lost part of the last part of the question. If you can hear me, or you can just raise your hand and let me know if you can hear me, because I cannot hear you. Okay, that's perfect. Thank you, Abby. Yeah, the part of the question that I had is was people die from different symptoms, like Haiti. I don't know if that's exactly the question. So anyway, I'm gonna try to answer that question since we talk about it. And all of you guys know this is a pandemic. COVID-19 is is everywhere. But for some reason, I don't know if that has to do with environmental factor, because we're seeing a different pattern in Haiti where people, they don't get fever, sore throat, or headache, or so some people, they just feel that they can breathe, or like within 2 3 hours. By the time to find a way to transport them to or the center or hospital, and within 24 hours, they just drop dead. So this morning I started talking to the director, Dr. Judy, about, because from the beginning I know some of the cases. There's some of the cases in U.S. I remember I speak with my brother, which is a doctor in Florida, is the one first talking about like a silent hypoxia. So people, they just get the oxygen saturation just drop, and they feel like dizzy, and right away they have a difficulty of breathing, and by the time they run to the hospital and they die. And I see this pattern in Haiti also. And usually they are young people between 20s and 30s, and they're not old folks. So
That's really interesting.
basically that's what we've been observing in Haiti. And at this point, we can't say they die from COVID-19, because most of them never been tested, but they just drop
Right.
and die.
And I think just to add a little bit more context, and then Kate, I want to turn to you for some questions from the chat. The other
Yes.
thing we're dealing with is things are
Definitely,
presenting
yeah.
differently. You've got folks
Yeah.
that don't have access to health centers. So in a situation like what Dr. Francois describes, things happen so quickly, and
Okay, let me
traveling
try to
hours
log
by
out
truck is
and
not
log in.
possible. The other thing we have to think about is there's a lot of fear around COVID in Haiti, so people don't want to recognize their symptoms.
We
They
have
don't
bad
want
communication
to
in
seek care.
Haiti. I'm sorry, guys.
That's okay. You're doing great. And then the other thing too, and those of you who are docs on the line, it's dengue season, right? So dengue fever runs rampant this time of year. There's also, Ruben's described them as the spring fevers that are also just part of normal day life in Haiti, May, June, and headed into the season. And so trying to distinguish between all these different things with the fear and stigma and, you know, presumed death sentence that COVID carries, you're seeing a lot of people not even want to recognize symptoms or to seek care. Kate, what are some of the questions we have from the group?
Yep. So I think we have lost Dr. Francois for the moment. So Melissa, I'm going to ask you the questions, and if you can answer those for us, that would be great. We have a couple questions surrounding deaths in Haiti. So one, have you seen a higher death rate this past month? And then have you been hearing about deaths that could be attributed to unconfirmed COVID? So
considering that, like I said at the beginning, there's a 24 more time infection rate comparing to May, is the same for deaths, in the sense that less, I would say at the end of May, I think we were in the probably lower than 30 deaths, and now we're talking about 76 deaths. So we've seen an increase in terms of death in general. And again, to the second part of your question is yes. Because many people are getting tested, and again with the stigmatization that Clark mentioned before, that people do not they do not want to be tested. They don't want to even admit as well that, you know, COVID-19 is real, and that's still very rampant right now. So a lot of folks are dying at home. And if they're dying at home, that means they're not being reported accurately. The other concern that they have is also that we see a lot with those cases that occur in the hospital is people are waiting when it's too late to actually go to the hospital. So there was a report that came out about deaths, like the statistic of deaths, that most of the people that have died, some of them are very young, and it's not because they'd had any they were a vulnerable population. It's just that, exactly what Dr. Francois mentioned, they had low oxygen saturation. They waited at home, didn't want to go out, they didn't want to be stigmatized, they didn't want people to know they had COVID, and when it got too late, they went to the hospital and it was just too late to help them. So I'm pretty sure that this death number that I share with you is grossly inaccurate. It's grossly inaccurate.
Thank you, Melissa.
I wanted to share some statistics with you. Somebody mentioned something about age group earlier. So remember at the beginning of the call, I mentioned we had about 4,441 suspected cases. In terms of the age group, the largest age group for the highest number of confirmed cases are the age group of between 30 and 39. 30 and 39-year-olds. It's about 1,400 people of that 4,450 that are confirmed with COVID. So it's interesting. It looks like it's the younger ones, people that are probably going out more, that are out in the street more. So that's quite interesting.
Maybe so. Yeah.
Of the world.
And also just their mobility too, right? In terms of accessing tests and that sort of stuff.
Exactly.
That's fascinating. That's like 2 decades younger than the most hard-hit group in the United States. And Melissa, your point about younger people getting out and about more, that's interesting. Yep. That may be the most important thing.
Exposure.
Yep.
Melissa, I have a couple more questions for you about our clinic specifically and what the numbers look like for patients in general, not COVID specifically, but are our numbers at our clinic remaining the same? Are they lower, higher? Is there any fear surrounding coming to the clinic to receive care? Can you talk a little bit about that, please?
Yeah, that's a number we've been trying to understand since the beginning of COVID, but now more. Interestingly enough, our numbers have gone down comparing to what we used to see before. And again, it goes back to the fact that in general, folks are just afraid to go to the hospital right now. Whether you might be a COVID patient or whether you have a different illness, people are afraid because there's a lot of rumors going around. And that's a big rumor that in the prevention campaign that CCH is doing that we're addressing. People have heard rumors that if you go to the hospital, doctors are going to inject you with COVID. That's a big rumor. And it's not only with CCH, we've heard it through partners around Haiti that are also experiencing the same thing. So people are just afraid to go to the hospital because, they might get injected with COVID. Another rumor is that there's a vaccine going around that's being tested in Africa and other countries. And once you go to the hospital, they might give it to you and consider the vaccine is a live virus, you might get it. So I think in general, folks are just afraid to go. They are afraid to go because they say once you go to the hospital, you probably have more COVID people that go there. And if you go there just because you happen to be there, you put yourself more at risk. So, we've seen a decrease in number of patients in general to come to our clinic. And again, I think it has to do with the stigmatization of the moment in general. And that's probably not going to change until, more folks are encouraged to come. But my worries is, people that are not coming, that have issues, that are not coming to the clinic. And, right now the focus is so much on COVID, but other illness is still very real. So when you have folks in general that are not coming to the clinic, that really scares me in that sense. But, we're doing our best to encourage folks to come. We make sure that whenever patients come to the clinic, even if it's past work hours, we still see them. We don't turn anybody away. It's because we know if they're making the effort to come, we have to make sure we see them.
I remember early on in this pandemic, even before Haiti had reported its first case, Melissa, Dr. Francois, and their entire team said, this is going to be really bad for Haiti because not only is the virus going to wreck this island, right? It will spread like wildfire, but they predicted that the healthcare system would respond the way that it has. And they also predicted that patients would struggle managing their chronic illnesses. You've heard us tell stories before about access and people who are trying their darndest to control diabetes hypertension, that sort of stuff. Those meds run out, those illnesses are uncontrolled. And so when you've got people who are terrified to come to hospital or clinic, those chronic conditions are going to start to be not managed. And we're going to see kind of a second underlying wave of health challenges that are just going to be exacerbated. Good question.
Definitely.
I think I have captured all the questions that came in through the chat. If not, you can send it through to me again, or I'd like to open it up. And if anyone wants to ask a question directly to Melissa or Dr. Francois, you are welcome to do that as well.
Yeah, Carrie, Nelson, I have a couple comments maybe and questions too. You know, Melissa, you mentioned some of the challenges with your chronic health patients, patients with chronic health problems in clinic. You know, we experience the same thing here, but on a different scale, of course. You know, I work in a reasonably large multi-specialty clinic in Western Wisconsin, and for a few weeks we were hardly seeing anybody. No one would come in. And we were happy about that in many ways because we knew that people were isolating and quarantining at home. We're starting to see things open up more. The other thing, you know, I'm just really impressed as usual with the way that CCH Clinic has handled this. I mean, the protocols, the carefulness, I mean, it's impressive as usual. But the underlying question of that, Melissa, and I don't know if Dr. Francois is on here, how did you develop your protocols? You know, I have the luxury of working in a huge system, the Mayo Health system, and my goodness, you know, we would get like 10 emails every day about how to do things and changing protocols every half day. And I guess I'm wondering, did you come up with these protocols on your own through research and reading? Did you get a lot of direction from the health ministry? How did you organize things there at CCH?
Okay, the way we come up with the protocol, and I've been reading a lot, and I go to the website, WHO and CDC,
Right.
and also in Europe, France, like country like Italy, and at the same time in MSPP. And we try everything. We put like we analyze everything, and based on our situation, is not the same country as other developed countries. We're on a broken system. So when you work on a broken system, things become harder for you to get it done. So we had to accommodate based on culture and whatever we have in Haiti, and to use our resources in order to make the protocol that can be adapted to the reality that we're facing in Haiti. That's how we get everything settled. And we glad that we did that ahead of time. And right now, that makes things easier for us because we started a long time before. We can just implement whatever is necessary to.
Yeah, well, it's impressive. It really is. Yeah.
One of the things that I'm also really proud of about this team, and I'm going to give them some kudos on this too, and Carrie, you'll be very excited to hear it. Dr. Francois, the other physicians, Melissa and Rubens, have already worked their way through and have contingency plans prepared for a day in which we are unable to continue allowing patients to walk through our gates. We are prepared to do virtual evaluations. We are prepared to have patients come one-on-one based on telephonic consults. We are prepared to work with some of the moto drivers that are helping in our health education things to deliver meds as needed. So those contingency plans are in place as well, because remember, one of our priorities through all of this has been to continue serving our patients for as long as possible, as well as possible. And Dr. Francois and Melissa have been huge leaders in making sure that we're prepared to do that.
Yeah, that's great.
Let me just give you a good example to illustrate what I just said. Like you see the mask that I'm wearing right now, and from the beginning, and I'm the one who designed and do the concept, and I send it to the MSPP director. And months after, and it's all over the place in Haiti right now. And and I started the project with the citizen movement, and I realized everybody should wear masks in order to protect, because we have a low resources. We can't afford to have COVID-19 like it is in the United States. And I made a projection, and I said it would be a disaster if we don't try to start early. And I think based on that movement, we save lives. And we don't know, we can't clap our hands and say we get things done, we get accomplishment. But I think we did the right thing. And that's what we continue to do.
Yeah.
Make sure everybody is.
Keep going, I'm sorry.
Yeah, make sure everybody feel there's people that are really care about them, and we keep on doing it.
I mean, one thing also that has helped us as well in this is, again, like Dr. Francois is he was tremendous in really thinking ahead of the curve. And I think this is why I would say, comparing to a lot in Haiti, so far, knock on wood, our management of how we navigate this process has been very, not refreshing, but very a calm process. For example, and also I think because, through some of our programmings at the clinic, the surgical clinic, we're thankful the surgical center, we had some items available that we were able to use in the beginning, but we had to innovate because, as you know, when the state of emergency occurred in Haiti, all flights were canceled. So there was no way to get access to items overseas. So we really had to think outside the box. For example, I mean, people that work in the medical field will know what I'm talking about. For example, we run out of surgical hats, and purchasing them in Haiti were so expensive, but we're like, what do you have in Haiti? You have tailors, you have fabric, and that does the job. So we had tailor-made surgical hats for us. For example, we talk about the coverall suits and plastics. We didn't have coverall suits and we needed to get some. We did get some, but we had some gowns that could be refurbished into coverall suits. So really thinking outside the box and really being ahead of the curve has helped us tremendously in how we have been able to navigate this crisis.
Agreed. And that creativity and innovation often just emerges in situations like this, because that's what you have to rely on, right, Melissa and Dr. Francois? That's part of it. Charlie, I see your question about how are we getting other items into Haiti. Thankfully, the port is open and remains open, and so shipments are coming in and out. And thankfully, we've received a few donations and have been able to purchase some PPE here in the States that will head to Haiti in the next 2 to 3 weeks. So we're very, very thankful for that. If you want to hear more about how some of these clinical services that Melissa and Dr. Francois have described today are married with a lot of health education, prevention, community outreach work, I do want to put in a plug real quick for our next Zoom call this week, which is on Friday morning at 10 a.m. Eastern. Rubens, our in-country director, as well as Dave Pierre, who is our education liaison, the two of them have been leading just these amazing prevention campaign efforts, along with a number of other staff and partners. And we'll dive into that deeper on Friday. So I do encourage you to join us for that. Those efforts all working together have, I think, really helped to inform the population there in Jacmel about how to protect themselves and others. It's been 2.5 weeks since we've had to turn anyone back from our gate to say, hey, you need a face covering. You gotta have a face covering. And so you can hear more and more about that. The moto drivers, the teachers, our new plans, which we'll talk about later this week, to take on the public market. We're thinking about hotspots and how we can reach further and do more using some of the models that already exist and some of these partnerships that we're so thankful to have in country. So join us for that 10 a.m. Friday. I want to be mindful of people's time. I know there's a couple questions that maybe we haven't been able to get to, or things that you've sent privately to Kate or Melissa. And we'll reach out to you by email to answer those, William. And I know Charlie, you sent a couple things too. But I do want to go ahead and close up now, if we can. First, by thanking you for joining us today. And really asking you to help us by sharing what you've learned here with others, helping them to understand the complexities of this, not only globally, but especially in Haiti. As we continue to see that uptick, we are in that exponential growth part of the curve. And so we are very, very thankful for the creativity and innovation that is shown, for the flexibility and adaptability that really defines how we operate in Haiti day to day, but certainly in a time of crisis like this. And before we do close, I want to remind you about CCH's Healthcare Heroes campaign that is going on this month. We have a bold goal, and that goal is to sign up 100 healthcare heroes by June 30th. Healthcare heroes are folks who commit to give $30 a month to CCH, and 100% of those dollars go to funding our healthcare mission in Haiti. Everything from PPE like masks and gowns to buying that fabric and working with those seamstresses to do what we need to do, to training moto drivers and teachers, to providing salary support for Melissa and Dr. Francois and the people that are out there on the front lines helping us every single day. And if you're interested in joining us in that effort, $30 a month goes very, very far in Haiti. Many of you on the call are already healthcare heroes, so thank you for that. If you're interested in joining us, go to the website, cchaiti.org. And if you sign up by June 30th, you also will send you these awesome CCH masks that you can wear around and keep yourself and others safer. So feel free to connect with us by email if you have other questions. Thank you so much for joining us today, and stay safe and enjoy your week. Thank you so much, Dr. Francois, Melissa, thank you.
Yes.
You are our leaders on the ground. We couldn't do this without you. So. Dr. Francois, I know you don't like claps, but we're going to celebrate. We're going to celebrate you today, all of you. So please tell the rest of the staff that we love them. Oh, I like that, Jamie. Around the clock. You can tell who comes from children's ministry. Thank you, everybody, for joining us.
Stay safe.
Thank you.
Wear your mask. Wash your hands.
Have a good one.
Keep a
Great job, Melissa. Yes. Wear your mask.
Take care.
Bye.